I am Michael Bustamante, he, him, his pronouns, and I am the Latinx Student Success Program Coordinator within the Office of Diversity and Inclusion. The LSS team works to cultivate Latinx communities for academic, social, and professional support. The LSS team promotes full inclusion of Latinx students and seeks to raise the visibility of Latinx groups on campus. Through high impact programs and collaborations, the LSS team is here to serve students, staff, and faculty of the Ohio State Latinx community. This goal is met with 3 signature programs: the MESA Early Arrival Program, the MESA Leadership Institute, and the Conversaciones con Café series. And more information about LSS can be found at our website at odi.osu.edu. Before jumping into our mental health and self-care webinar today, I'd like to note that ODI is celebrating its 50th anniversary. As the university celebrates its sesquicentennial, the Office of Diversity and Inclusion has a special anniversary of our own to recognize: our 50th birthday. From our tumultuous beginnings in 1970 until today, our office has stood proudly as a fierce advocate for historically underrepresented students, staff, and faculty. The world has changed over the past half century, but we have never wavered from our bedrock belief that greater inclusion has merit and diversity brings us strength. It is important to us to honor the giants of diversity and whose shoulders we stand on today. And that is why in early 2021, we will induct the first 50 icons of inclusion into our inaugural Office of Diversity and Inclusion Hall of Fame. As we turn 50, we vow that our best days are ahead of us. We have ambitious plans to expand our capacities by tirelessly building on the foundation of our first half century, removing barriers every day. We all benefit when diversity and inclusion is woven through our daily work, and to succeed, we must all pull together. We look forward to your continued commitment as we push onward for the next horizon. That said, please allow me to introduce our offices, and panelists today before giving them the floor to present. A little bit about the Office of Diversity and Inclusion. ODI is one of the oldest and most comprehensive offices of its kind in the nation, with a mission to help build Ohio State into a world-class model of inclusive excellence. We provide scholarships, mentoring, tutoring support, leadership and community building programs, undergraduate research and study abroad opportunities. Learn more about our programs and resources at odi.osu.edu. Today from ODI, we have presenter Peter Oduwole, clinical therapist, Office of Diversity and Inclusion here at The Ohio State University. A little bit about the Office of Student Life, Counseling and Consultation Service. They provide individual and group mental health services, psychoeducational prevention and outreach programming to currently enrolled undergraduate, graduate, and professional students. They also work with spouses and partners of students who are covered by the comprehensive student health insurance. Today, from this office, we have Dr. Marcy Ramirez, Senior Staff Therapist, Office of Student Life, Counseling and Consultation Service, also from The Ohio State University. Welcome.
Thank you.
Thank you.
All right, so Peter, do you want to start by introducing yourself a little bit more?
I will. So thank you so much for that introduction, Michael. My name is Peter Oduwole, and I am the embedded clinician for the Office of Diversity and Inclusion, and I am actually coming up on completing my first year with the office and the institution. And so I basically serve as a liaison between counseling and consultation service for the students who use the services and scholarship programs of ODI. When we were in person, I was hosting group sessions as well as couples counseling as well as individual sessions, and then definitely making my way around campus to lots of student organizations doing outreaches such as this. We'll provide some psychoeducational options for students to learn about mental health, and so that's kind of what my role is, but specifically for ODI, and I'm really grateful to be able to serve the students in that way.
All right, So, hi everyone, my name is Dr. Marcia Ramirez. I am one of the psychologists at CCS. We have two locations, which I'll get into, but I am located at the Latinx Success Center. What I do in particular is work with students that identify as Latinx, undergrad and graduate students. That's not the only population that I work with, but that is my specialty. Having said that, I do individual, group therapy, couples therapy as well. For group therapy, for spring 2020, I did start a Latinx group for graduate students. Unfortunately, because of the virus, things changed and we had to stop. However, there is still hope. For fall semester, I am hoping that I could do the group again for either graduate students, a mixture, or for undergrads. The only thing with that is that this is where, the students will come in. It's like, if the need is not there, then we're not going to be providing services. I know that there's people out there that, might not be aware that I'm at CCS, or that there's a possibility of having a Latinx group. But there is, yeah. And, you could always send me an email, and I'm more than happy to give my email at the end of the presentation. So reach out to me, let me know if there is anything that I could do to support the Latinx community. That could be something similar to what we're doing right now, which is for me to come and present on something that has to do with mental health, or just go over, CCS services and introduce myself. So even if you know someone that identifies as Latinx that are not necessarily here, I would definitely encourage you to let them know, because that's how, I think I'm going to be able to, be known by more people that identify as Latinx, because I could only do so many of these, but that doesn't necessarily mean that other people that are not in attendance are going to be able to know about this. So, let them know that if they have a need that they see within the Latinx community, to talk to me. They could send me an email, and I'm more than happy to be able to see if we could accommodate those needs. All right, so I'm gonna, me and Peter, we're gonna focus on talking about a little bit about anxiety, how to recognize that, some depression, and self-care. The reason why we chose those two things, or three things really, is because of everything that's going on right now. And, just in general, those three things are some of the things that we see the most. Anxiety and depression are very prevalent among the community population, the college population, sorry. And self-care, that's like the most important thing to be able to deal better with your mental health. And especially right now with everything that's going on, the quarantine and staying at home, I think that this is like, it's more important now than ever. So let me go ahead and start talking. I'm not sure if we're able to share my PowerPoint, if that's going to be even important to share, Michael.
Yeah, you should be able to. On the bottom of the screen, there should be a share screen button.
Okay, let me see. Nope. Okay. I'm assuming this is it.
There you go.
Okay. And do I just start this? I am terrible at this. All right, let's see. All
No,
right.
you're great. Is it going to be a PowerPoint?
Yes, it's going to be a PowerPoint.
Okay, I think you might be able to have to open up your PowerPoint.
Okay, because in my, it says I'm sharing. Am I not sharing?
Yeah, so I can see your Carmen Zoom page.
Oh, yeah, that's not. So how do I share then my, do you know how to share, Peter? Because I think you have it too.
Yeah, I might be able to try. So I can go ahead and try if you want to stop sharing.
Yeah, because apparently I'm challenged when it comes to sharing.
No worries.
Technology.
All right, so here we are. Is that better? Are we able to see?
I could see it, so
Yes.
I'm assuming I'll see it.
All right.
All right, so unfortunately, I'm gonna have to tell you every time you're gonna have to change the slide, Peter.
No worries.
All right, so this is our title, Beating Mental Health. All right, so if you want to go to the next one.
Try to move this out of the way as well so we can see what's on the screen. Okay.
All right, so who we are. So like I mentioned earlier, we do have two different locations. Our primary location is at the Latinx Success Center, which is where I'm at. We're on the 4th floor. Our second location is at the Lincoln Tower, which is on the 10th floor. But we also have several embedded clinicians, including Peter, of course, and we have other people that are embedded in, you know, for example, the engineering department, optometry, law school, and other ones that we also do have. It is confidential services that we provide to all enrolled students. And we also provide therapy in different types of language, including obviously Spanish that I do. So if you want to do sessions in both Spanish and English, I could provide that. You know, we could do either or both. Spanish is also an option. So I'm more than happy to do that as well. We do have culture specific services. You know, for example, one of the things that I already mentioned, which is the Latinx group that we provide. We also have some groups that are more focused on people of color, the LGBTQ and men's group that I believe Peter is also facilitating one, or was, because of the virus. So, you know, but it's still there. And we are a training facility, and that's maybe something that most people don't know. We do have people that are early on in their career. They're still going to school, they're getting their hours, and they're getting that training and that experience in providing therapy. And there's people that are a little bit more advanced in their education that are, you know, about to get licensed. So not everybody is not licensed, but there is like a good percentage of people that are not licensed. Do you want to go to the next one? All right, so the services that we provide. So we do provide individual counseling. We provide group counseling. On a normal basis, pre-virus, we had 30 plus groups that we will provide each semester. And they focus on different variety of things. You know, there's a mixture between both undergrad and grad students. There's some that just very specific for that population. But because of the virus, we had to stop most of the groups for fall semester. The question is not if we're going to have it, the question really is well, how are we going to provide those services, especially group, because there's more people in the room. Probability is that we're probably going to do Zoom group therapy, but I can't really say 100% sure, because that's something that people are still trying to figure out how we're going to do everything. The same thing as individual. Right now we are doing Zoom appointments. So if people are interested in doing therapy, they're more than welcome to do, but I understand that some people might not feel comfortable doing online therapy. We also provide urgent appointments, and that's usually for people that are in crises, people that need to be seen by a therapist within a few hours or a few days, just depending on the severity of the crisis. We also provide that. And if they need to, you know, receive a higher level of care, we also help to, you know, help them out, be able to get connected with that higher level of care. Pre-virus, we would do drop-in workshops and consultations, and that kind of stopped a little bit. There are some the videos that some of the CCS therapists recorded, and there are on our website about different topics to help people manage better the virus, or just different aspects. And I'm assuming that that's what we're going to do for the fall semester. But once again, you know, I can't really say how that's going to look, but I'm pretty sure that we are going to have it, because those are that's one of the services that is really needed. And it's really beneficial to be able to get a lot of students, or be able to disseminate that information to a lot of students. For the consultation piece, that's kind of what we're doing right now, which is, you know, psychoeducation, being able to make people aware of our services, you know, not just our services, but also at CCS, but also other OSU resources that are free for students that we feel that are beneficial for students. Because mental health it doesn't necessarily mean just mental health or therapy. It could mean, you know, getting information about, you know, sleep hygiene, how to improve your sleep, you know, getting connected with a registered dietitian to, you know, discuss like any eating concerns. The Smart Lab, which, you know, it's another free one. So we like to inform client or students of all the OSU resources that are free for them. And, you know, why not take advantage of them? It's free. And not only are they free, but it's beneficial. The last one would be the psychiatry services that we do have. I believe we have 2 residents that are coming in, or they already started, I'm not quite sure. So that's a great thing, but we also pair or work very closely with Will's Student Center. So not just because you need medication, that doesn't necessarily mean that you necessarily have to work with a psychiatrist. There are certain times where we might refer you to a doctor at Will's. They are, well-known and well-versed in medication. And sometimes it's good to be able to keep all your services with one specific provider. If you need to go to for medical reasons, you could go to the same doctor. So that's like the benefit of being able to get connected with someone at Will's. Next slide, please. All right, so how do we make appointments? So we have 2 different ways of making appointments, but regardless of what you need, what kind of treatment you're looking for, you do need to do either or. One of them is calling our front desk and letting them know that you're interested in starting treatment. They will schedule you for what we call a phone screening. The other option would be to go to our website and schedule your phone screening yourself. With the phone screening itself is 10 to 15 minutes long. So whatever date and time you chose, the therapist will give you a call during that time. They will ask you different questions. Those questions are used for us to be able to assess what your needs are, the severity of your symptoms, and we use that information then to make a decision of what your treatment's gonna look like. Are we gonna refer you to a therapist here at CCS, or are we gonna refer you to someone in the community? And that decision is based on different things, and is very unique to that student. I think that is it for this slide. Next slide, please. All right, so now we're going to transition talking a little bit more about what is anxiety. So what is anxiety? I think that maybe not a lot of people are aware that all of us have that ability to be anxious, right? And anxiety is not something that's always bad. It's actually it could be a very good and beneficial thing that we all possess, because it's a way of our body to alert us if there's any danger, if there's a threat, and if there's any changes, so it keeps you alive, and it has kept us alive up until now. So, anxiety is not bad. I think it becomes bad when it becomes very severe in the individual doesn't have the coping skills to be able to cope well and use that anxiety as a good thing. That's when it becomes like, it could become very problematic for the individual. Next slide. All right, so major stressors for college students. Obviously, the list could be way longer, but I felt that these are the ones that we see the most, and we're going to stick with this one for now. Some of them are relationships, and relationships could not only mean like romantic relationships, but could also be like relationships with roommates, relationships with peers or professors. It could be any kind of relationship, really. Roommate conflicts, time management, that's another one. Academic concerns, finances, and changes. So that's, bolded for a reason. And we didn't necessarily list specific changes because every person's going to present with different types of changes that they're having a reaction to. If we look at where we're at right now, the BLM situation that might be triggering a lot of anxiety for some people. The virus, that not only affects the person that actually tested positive, but the whole family, and and that could also affect people's employment, which we kind of go back to the finances. So some of the things are very interconnected, and one kind of affects the other one. And it sometimes it's not unrare or not rare if somebody comes in with several stressors. Sometimes depending on the situation, it could be one specific stressor, but for the most part, I at least from my experience, I feel that there are usually several stressors that are affecting someone. Next slide. All right, so how does anxiety present itself in a classroom? Well, everybody presents anxiety in a different way, so I think that if you feel that you have anxiety just looking at this list, you probably might be able to check mark a few of them, and if we have someone else do the, check mark their list, it's going to look very differently. But one of the things that, or some of the things that we do see very frequently are just like changes in your mood, being angry, maybe being a little bit more irritable, tired, because it does affect your sleep if you're having difficulty falling asleep and kind of shutting down your brain because you're thinking of all the things that are causing you stress. you know, it could even cause, you know, the more severe, which is like suicidal ideations, because like the stress just gets too overwhelming. And if you, you know, add to that, like maybe poor sleep because of the anxiety, and then maybe you're not really focused in school because you're tired, you know, it's just like a snowball effect. And it could also present itself as a, you know, a student choosing not to go to school because they feel that every time just thinking about it, going to school increases their anxiety. So like, you know, if you think about it, it's like, it would make sense to stay at home and not go to school and not raise your anxiety. But the only thing is that there are consequences if you don't go to school or go to class. You know, you're going to get lower grades. You know, you might not do very well in your tests, or, you know, you're not really going to get, build those relationships with your peers and classmates. So it affects everything. Use of alcohol, you know, alcohol is a depressant, and any kind of most drugs are a depressant. So when people have high levels of anxiety, if they drink alcohol, temporarily it does feel like they're managing their anxiety well. The only thing is that it could add another problem to the already existing one. You know, if people continue to medicate themselves with alcohol to cope with that anxiety, you know, it could then become problematic. Not for everyone, but it's always good to know that, or ask yourself if you're using alcohol to manage your anxiety. And if that's the case, maybe asking for help before it gets out of hand. Poor coping skills with everyday stress. You know, I kind of talked a little bit about that. You know, choosing not to go to school because it's anxiety provoking, or if you have concerns with like social anxiety, you know, excuse me. That could also be, you know, problematic if you decide not to, you know, get involved with like bigger groups or, you know, presentations, anything that will increase your anxiety. If you avoid that, while it temporarily helps you alleviate that anxiety, at the end of the day, you know, there's still going to be some negative things that are going to come from that. Next slide. All right, so anxiety. You know, I am going to sound like a broken record, but anxiety is not bad. You know, there is good and bad of anxiety. If we're looking at, for example, a basketball player, I don't know, playing a game, you know, in front of everyone, that could cause a lot of anxiety for that individual. However, this individual has learned to be able to use that high levels of anxiety and use it to their benefit, be able to use it as a way to focus better, you know, to help improve the performance, to maybe practice a little bit more on maybe like the things that they're not really good at, so that when the game comes, you know, they're able to perform a little bit better. They feel that, and when stress is good, people normally have that within themselves, knowing like, I got this. I know how to deal with my anxiety. You know, I'm going to use it to motivate me. I'm going to use it to be able to do a little bit better. And it is short term. You know, if we're looking at that basketball example, you know, it could be just for the game, or it could be, you know, if you have a hard exam coming up, it could just be for that exam. So it could be very short term. The bad part of it, of anxiety, is that it could be both either short-term and long-term, just depending on like, you know, on the situation, and depending if you have ever asked for help, or even if you even know that it's a problem for you. You know, it does trigger a lot of physical symptoms for people, upset stomachs, you know, headaches, dizziness, you know, and it could even trigger panic attacks for some people if it gets a little bit more higher. The performance, if we're going back to the basketball example, you know, this individual that is not necessarily able to cope with anxiety well, it's going to mess with their concentration, because all they're thinking is about like 10 million other things, and they're not really focused on the game, or they're not able to really focus on like, maybe I'm not terrible at playing, but maybe I'm just not that great at this particular thing within like the game. And I don't know why I'm using that example, but I feel like it's an easy example to use. So well, what else am I going to say? I think that's pretty much it for this slide. All right, so how do we know when we're stressed? Next. All right. So recognizing anxiety. So these are like the three main things that I want people to look at if they feel like, if they've been thinking about, you know, maybe their anxiety level, or if they're coping with their anxiety well. You know, of course, I think because anxiety is something that helps us, all of us, keep us alive. I think we're all going to be able to mark off a few of them, right? I think it's like, you really have to ask yourself, like, all right, well, are these things that I marked, are they affecting my life? And if so, what areas of my life are affecting? And I think that that is a question that then will probably lead you to decide, to make that decision to maybe call us or, you know, schedule an appointment and start treatment. So for like the physical symptoms, I kind of touched a little bit on those. Like I said, everybody presents a little bit different, but these are like the most common and more frequent ones, which are like headaches, upset stomach. You know, some people actually report, you know, losing an appetite, or other people might actually have, you know, to deal with their anxiety, they might snack a little bit more than usual. So that could be something. Hands, people could feel like a difference in their temperature, so they could get either cold or hot, just depending on, you know, on the situation, increase in blood pressure, you know. And if things like this don't necessarily get addressed early on, they might have a panic attack, that, or they might feel that they have a medical condition. And having said that, I feel that I also want people to be aware that sometimes there are medical conditions that do trigger anxiety, you know. So if you can, and you know, I would say talk to a doctor, you know, beforehand, talk about all your physical symptoms and the things that, and how long have you been experiencing. And they're trained to ask you specific questions to help you determine if it's just anxiety or if it's actually a medical condition that needs to be addressed in order for it to decrease your anxiety. And you might not necessarily need therapy. The mental and emotional symptoms, there is changes in mood, you know, difficulty with concentration is definitely something that most people experience. Being restless because of all the anxiety and all the adrenaline that's like pumping in your body, it's really hard to sit down and sit still. Being irritable and angry, that is definitely a way that people express that, you know, that once again, full of adrenaline in your body, and it's just like, I just want it out. So this is the way that I'm going to express it. The behavioral symptoms, avoiding or withdrawing from people or places, because temporarily it does help to control that anxiety from going to a 10, you know. So the only thing is that once people continue to do that, they might not necessarily have as many friends as they started off with, because if you continue to say no, 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 you know, people might take that as like, well, they don't want to be my friends, or, you know, interpret it differently, when in reality is that you just don't know how to cope with your anxiety well. Increase in alcohol use, which I talked a little bit about. Avoiding conflicts, or because if you're someone that kind of expresses your anxiety in a more angry way, then, you know, it could probably actually increase conflicts in your life. So it could go either or. Next one. All right, so how does it impact our body? Like I mentioned, it is something that we have, all of us, to keep us alive. And it's a way that our body has a voice that tells us like, hey, you should be careful. Hey, this is probably not the safest thing. So it does it by giving us a fight or flight response. And that's how we're alert. The only thing with when people have anxiety is that they have the same response. The only thing is that the threat is not there. It's just the fact that you have, you know, the fear of speaking to a big group, or the fear, or you're just anxious around, you know, driving a car. I don't know. People have different anxieties. So when people have that stress, like their nervous system is affected, it does release a lot of hormones. And when that happens, people experience a raise in blood pressure, you know, their heart rate increases, their breathing gets a little bit more choppier, you know, and people assume that they might even be having a heart attack, because it's like that might be like their first experience. So, you know, if you think about it, it's like that is scary just in general, having like your heart going so fast and you can't do anything about it, you know. So it stops your digestion, it causes a surge in blood pressure, and all of this is, you know, wired in our body to be able to help us be able to protect ourselves a little bit better, you know. But it's not a bad thing. But when it continuously happens every single time someone has high levels of anxiety, that's when it starts potentially creating medical conditions now. You know, if it continues to do that with your digestion where it stops, you know, or are you going to have like stomach ulcers, you know, are you going to have like heart problems? And while I don't necessarily want to get too gory in what the possibility that could happen, but that's the reality of it. It's like that, in the need for therapy to be able to help address that anxiety early on, to hopefully eliminate those medical conditions that might potentially happen as a result of high anxiety. Next one. All right, so before we get to you, Peter, I know someone is raising their hand, or I think they have a question.
We do. It looks like there's a question here. I can go ahead and read that out loud.
Yeah.
Are there cultural cues staff can look for in Latinx students in order to help identify a mental health concern?
Yeah. Should we, since I feel like that's a good question, but I think that we might probably wait for it until the end to address those.
Yeah, we can answer questions at the end. For
Okay.
those attendees, if you'd like to use the chat function at the bottom to ask those questions, we can
Yeah.
save some time at the end of the presentations to ask those questions.
Okay, I just wasn't sure if like the question was, I can't hear you. So, but
No.
all right. So, all right. So Peter's gonna take over and talk a little bit more about depression and some self-care.
Thank you, Marcy. So yeah, I'm going to speak a bit about depression and kind of give some insight and context in the same way Dr. Ramirez just did about anxiety. And so when we think about depression, there's been a lot of stigma that has been reduced over the last several years as we talk about mental health, both anxiety and depression. But there's also been some, like that's been a really great thing, but at the same time, that's also been something that there may be words that are used to describe experiences that are not always describing what we really mean to be describing. And so sadness is not a synonym for depression, right? We all get sad about many things, but depression lasts longer than just your average sadness. And it can be triggered by many different things and explained by many different things. So it looks very similar to sadness though, right? So your mood, it might be that you're irritable or down or feeling blue, feeling hopeless and empty. You experience a loss of interest and pleasure in things that you typically once did. You might be isolating yourself, right, from your peers and your social group. Sleep might be impacted. You might be sleeping more, way more than you need to be sleeping and or so much less. Your appetite in very similar way to sleep can be impacted where you're eating a lot more or eating a lot less than you should be eating to feel sustained and energetic. Concentration might be difficult, right? Where you're supposed to be sitting on a study and you realize that it's much more difficult to focus on a piece of reading than it was several weeks ago. You might experience a loss of energy or feeling fatigued, very similar to anxiety actually. And also feeling worthless or guilty for some things. And so your self-worth is brought into question often when depression comes along, which makes a lot of sense because if you're not doing a lot of the things that you once were, you might feel like something is inherently wrong with you. And then it also could be something that is accompanied with thoughts of suicide or self-harm, right? And so if you're feeling worthless or guilty for experiencing mood in this way, and your friends and your relationships are impacted because of it, it might lead you to feel like, you know what, what's the point? And having really dark thoughts. And so that's something that all of these are signs of depression that should be interrogated with a professional, right? Or with a loved one. And the piece about depression that differs from your average sadness is that it also affects your functioning, right? So the fact that you just feel down is simply not enough for it to qualify as depression, right? It also has to meet the threshold of like, you know what, now it's hard for me to show up to work. It's hard for me to show up to class, right? It's hard for me to take care of myself, to eat food or to clean myself, to make sure my place and my space, my environment is reflective of the person that I want to be, right? And it encourages me and fulfills me. Those are all ways that we can measure our functioning. And depression definitely impacts those specifically. So what causes depressive symptoms, right? So Dr. Ramirez just gave us a great overview of how anxiety can impact our body stress, the difference between eustress and distress, right? There are some good stressors that help us accomplish things, but distress can lead us to having our functioning impacted. Transition can be a cause for depression, right? So if you are embarking on a new journey, like starting college or surviving a pandemic, right? That can be a reason that your mood is greatly impacted. Grief and loss, very much related to all the things that are going on now, right? It doesn't have to just be grief related to the loss of life of a physical person, a living person. It can be loss of an experience. It could be loss of what feels like stability. All those things are worthy of grief and can lead to depressive symptoms. Seasonal depression is real, right? It could be seasons as in like spring, summer, fall, winter, but it can also be seasons of holidays. It can be seasons of anniversaries, of things that bring about mood that shifts to what looks like depression. Hormone changes, so kind of getting back into that medical field, where your body is just changing and responding in ways that you might not understand in the moment. And that can be something that can explain depression. Substance use, right? Dr. Mears just spoke about how alcohol is a depressant and how it feels like that you're, addressing the depressive symptoms or the anxious symptoms, but really you're actually just increasing them more. And so that, like, substance use is really something that does not go well with managing poor mood. Genetics can also be a factor, right? It can be something that is inherited, that if you have family members who have dealt with depression, that might be something that you are also realizing that, wow, I'm coming into my own experience with this. How am I going to manage it? And it can also be something that just happens, right? The way that we respond to our environments is greatly dependent on what the environment allows us to have. And so if we're in a situation where we're feeling supported and the resources are there for us to thrive, we could still experience depression, but we might be able to respond in a healthier way than if we didn't have those at all. And so the way that the depression manifests might look very differently from person to person. And I will also add, I think someone asked in the chat about the cultural cues to be able to identify things. I want to name here specifically, as we're talking about the Latinx community, as a Black person, I am not well versed on all the different ways that culturally depression may manifest, but I do know that it would vary from what is standardized when we're talking about mental health, right? Many of the ways that we identify mental health symptoms are based on largely cis, heterosexual, white people. And we're trying to tailor it to our marginalized and racialized communities. It's important to factor in that there are different things that contribute to how we manifest because of those racializations and marginalizations, right? So I'll speak for myself as a Black man, right? It's something that if a Black man were to feel depressed, to feel low and to feel down and to express that through what we would identify as crying, right? That doesn't seem like something that would be recognized or celebrated or encouraged even. And so it might come out as something that's more acceptable with the gender of man, right? Where anger is something that is allowed to be, that men are allowed to express more than they're allowed to express sadness or grief or cry in that way. Right. And so if you see that somebody's irritable all the time or they're expressing aggression, like, it might not be that they're angry. It might be that they are sad or depressed about something, but you might not know that if you don't qualify it with the cultural consideration. And so I'm not saying, right, that every Black man you see is depressed or angry or anything like that, but I'm just encouraging people to consider, how does this look based on my culture and the way in which we have been not just marginalized, but kind of how we understand what it means to be a person with these emotions, how we express, what is accepted in this space. Because some of the standards that we have about it are not considering of our communities. And so that's something really important to think about. And so let's talk about self-care, right? Self-care, along with depression and anxiety and mental health, are all these buzzwords that we use now to talk about being well. And I think it's a great thing, but I also think sometimes it can be something that we are sometimes conflating and not really speaking accurately about. And so self-care is really just the strategies that we use individually to stay well, right? When we're talking about being healthy, we're not talking about being rid of disease. We're talking about living in a way that allows us to thrive, regardless of what our environments looks like. And so that can be some of the tips here on this slide, such as being mindful of how many hours we're getting of sleep so that way we're well rested, physically well rested. Eating enough meals. I mean, 3 balanced meals is something that we're all taught growing up about what is healthy for us, but it can also it can vary, right? Some people's bodies differ. And if you're working with someone who knows what your body is supposed to be intaking to feel sustained, then that is important as well. Exercising, being active. I like to think about it as just being active. It doesn't have to be dedicated. I go to the gym every day or I go for a run every day, but it can be something as much as going for a walk around your neighborhood. Just being active in some way is really important. Paying attention to nutrition. So not just eating the 3 meals a day, but eating balanced meals. Like, what is it that you're putting into your body that brings you energy instead of drains you of energy? Avoiding substances, right, such as alcohol, even marijuana, right? So marijuana is actually a stimulant. I was very surprised to learn that when I did, but it actually increases the heart rate. And some people think and experience that it relaxes them, but it actually physically does something very different. And so that's something to consider when we're considering, why am I still feeling, anxious in my body, even though my eyes or whatever else feels real relaxed, right? Medications, if we're on a medication regimen to treat maybe a diagnosed mental health condition, that might be something to consider about wow, how am I staying well right now? Am I taking my medication so that way my mood can be managed and my energy can be at the level that needs to be for me to accomplish all of my obligations for the day? A good way to measure if we're staying well can be through hygiene, right? Did I shower today? Am I wearing clean clothes today? What does my environment look like, my living environment? Is it reflective of how I feel? Does it look kind of not messy, but just things are strewn all over the place, which feels like what I feel like inside. Things are strewn all over the place, right? Is it reflective of that? That's something to be thinking about. Self-care also looks like scheduling therapy appointments. It also looks like studying ahead of time so that way you're not stressed the night before an exam. It also looks like advocating for yourself when you're in conflict with one another, right? So that way that the stress doesn't continue to build and build and build where it feels so unmanageable that it's overwhelming, and then you have those symptoms of depression, anxiety, right? So it's also being proactive about what you might anticipate will come in the future that might lead to more stress. So emotional wellness, right? Talk it out. Dr. Ramirez and myself and our colleagues in CCS are really great options for that, but those who are not the only people on campus that can, you can talk to. Good friends are really important. Having a supportive support system of people that you can go to without judgment, people who will hear you and engage you in good faith, right? People who won't just assume that you are victimizing yourself or dramatizing your own experience, but will engage what it is that you're saying in good faith are really important to have. Having deep conversations where you feel validated and affirmed is really, really important. And so therapy could be a really great option for that. But if you also have other people in your lives, it's important to manage self-care in that way too, right? Because you want those relationships to be reciprocal and you want them to be healthy. So to have somebody that's unbiased, like a clinician, a professional, is a really great option. So that way you don't have to feel like you're burdening each other. Although that can be something processed through therapy too, because I like to think that you're not burdening out your friends. But that's just something to consider there. So when we're talking about cognitive wellness and considerations, cognitive is just the way that we think, like how our brains work and how we conceptualize what it is that we're perceiving in our environment. And a lot of times it can be the things that we're telling ourselves, like self-talk. So when we're thinking about anxiety and depression, we can have things that manifest like negative thinking. So predicting that things will turn out badly. Right? It's kind of like making the assumption like, oh, that's not going to work out, or I'm going to do poorly on this, or this person didn't mean well by me, when that might not actually be the truth, right? And there could be reasons for why we're already leading with that first thought. Discounting the positives, rejecting positive experiences since they don't count, right? Always using the word never or always to express things instead of allowing for some nuance of, well, maybe this could be what's going on, and also maybe this could be what's going on. Typically when we're overgeneralizing, it's, no, this is exactly what's happening because it always happens that way, or this person never does this thing. And that might not actually be what's truly happening. Overanalyzing things, which can be a great symptom of anxiety, right? Of overthinking and thinking to the smallest component of a situation about what you could have done differently. Man, if I had just done this differently, and then this is another way that I messed up. That can be really important of identifying anxiety and or depression. Self-criticism and blame, being really harsh with yourself, even unwarranted, or even when unwarranted. And then also the rigid thinking, right? So black or white thinking, or either or thinking. It's either this or it's that. It's never possible for it to be both. And it's really, really important, especially in the time that we're living in now, for us to consider the nuance of situations, that it could be possible that both things are true. Especially in interpersonal conflicts. It could be true that somebody meant to do well, but their impact, well, yes, their intent was to do well by someone or by you, but their impact wasn't as such, right? Both those things can be true. And if it isn't perfect, then it's failure, right? So it's kind of like this exaggeration of like, oh, it has to be, I love Beyonce. It has to be Beyonce, right? But we just got, and I'm not gonna be shady, I'm not gonna say that, but we just got somebody that's not Beyonce. So kind of just exaggerating in that way. These are ways to think about how we're thinking about our lived reality and our experiences, and ways to think about how consistent they are with what Dr. Ramirez and myself have already provided context on with the depression and anxiety. So here are some mind-body approaches to managing stress. Move our faces a little to the side so I can read. So counteracting the stress response can elicit a relaxation response, right? And it's really important to be mindful of what is happening in our bodies in the immediate moment. We call it immediacy in counseling. And so when we're thinking about what does our breathing look like, right? Am I taking deep breaths to get enough oxygen to my brain so that way I can make rational conclusions, right? Usually when we're in elevated and in anxious states, we're taking short, labored breaths because we're anxious and we're alert and our bodies are tense. Our muscles are tense. We might be furrowing our eyebrows or balling up our fists. We might be clenching our teeth, tensing up our neck. And that's something, those are all things that are happening without our awareness. It's really important to bring our awareness to those things so that way we can address them and remind our body that that threat is not present, or it's not as immediate as it feels, right? So that means taking deep breaths, realizing what's happening with our heart rate and our blood pressure. Are our hands and feet getting warmer? Why? What's going on? Am I sweating? Am I shaking in any way? There's another word for that I can't remember right now, but yeah, how is my body responding to this emotion that I am experiencing right now? The mind directs the body to relax, and then the mind follows, right? So if you're using your mind to tell your body, okay, let's assess the situation for what it is, and then tell your body to follow suit, then that can be a really good practice. So here's some examples of mind-body approaches. So abdominal breathing, kind of what I was just speaking of. Oftentimes I'll ask my clients to take a deep breath, and they'll usually take a deep breath and their chest will go up, right? They go, and then you see their whole body rise. And that's great, but that's not the most effective way to breathe, right? We should be breathing from our diaphragm and our abs, right? Which we often do when we're relaxed. When we're not thinking about our breathing, we're usually breathing from our abs and from our diaphragm. And when we're being intentional about it and somebody asks you to take a deep breath, that's when we become self-conscious about it and do the chest breath. But really, to get the most effective oxygen to our brain to make rational conclusions, we should be breathing from our abdominal area. Breathing out, right? Our stomach should be going out to get enough oxygen in. And that might feel uncomfortable, but it's something that you can become comfortable with if you practice it. Progressive relaxation is a technique where you're intentionally tensing up your muscles and then relaxing them to notice the difference and notice how much more comfortable you are when you are relaxed. So it can be an entire body experience where you're starting from your toes, crunching up your toes in your shoe or in your sock, and then releasing them and feeling the tension release, right? Going up your body into your calves and into your thighs, into your abs, into your chest, even to your face. You can do it with your facial muscles as well. Meditation is super important as well, right? Really grounding yourself to what is happening, again, in the immediate moment, developing an awareness of what's happening in your body. Yoga and Tai Chi are really great practices that can help do that. And so these are just some examples of some mind-body practices. Gratitude is also a really great way to reframe what is stressful and depressive for us, right? So gratitude is simply acknowledging and being appreciative of what it is that we do have. We can all think of, especially right now, we can all think of so many things that we don't have. We don't have, some of us security. We don't have, some of us might be hope, might be lacking some hope in this point. Energy, connection, in this time, we might be lacking connection. But what it is it that we do have in this moment is something that is really important to take inventory of as well, because it changes the way that we look at stress, ourselves, and the world. And it also changes our expectations for what is to come. If we can orient ourselves to what's happening now, then we can think about, okay, well, I have this and that can get me to tomorrow, right? Right, I can get me to this evening. And it can increase our feelings of happiness as well. So academic anxiety and some study skills. Here's some ways to think about how to reorient yourself to that. Think about what is it your environment looks like. This is difficult in the time of COVID now, right? Like I used to tell people, are you doing your homework in your dorm, in your room, where your bed is looking right at you, like, come play? Right? Or can you go to another space like a library or to a coffee shop or another space that allows for you to be oriented to this space is here for work, not rest. That is still something that you can do right now, even in time of COVID. Maybe you don't do your homework in your bedroom, but you do it in the kitchen, right? Where you're sitting at a place that is still oriented for work or for space that is also not designed for rest. Just be creative with it. You can do difficult tasks at the very beginning when you're setting up to study or to begin some kind of academic activity. So that way you can use most of the energy that you've already amassed and saved up for after you've rested on that task. And then the easiest task, you don't need to dedicate so much energy for. Maybe when you start though, and you feel like, okay, this is a lot more than I can chew off right now, maybe switch to the easier tasks so you can get that confidence boost and then go for the more difficult task later. The 50+10 rule is a really good rule to have. So working for 50 minutes and then breaking for 10 minutes, right? So maybe, I think it's, when I was an undergrad, we used an app called Pomodoro. It might still be a thing where we could set it for however long we wanted to work, and it would block all your access to social media. And so for however long you set it for, if it's 50 minutes, then that's what you're doing. You're reading or you're writing for 50 minutes. And then when that break is up, Pomodoro lets you get on Twitter and you can scroll for 10 minutes. And that allows for you to acknowledge the human person that you are. We're not robots, right? We're not built for production. Capitalism would disagree, but you are a human. And so you are allowed to rest. And so take a couple minutes to rest and then go ahead and get back into it. Avoid cramming, right? So work back from your due date. If you have a paper coming up, if you see that, think about how you want to split that assignment up so that way it doesn't feel so overwhelming that you don't start at all, right? Break it up into little pieces that feel a little bit more manageable. And then when you're burned out, switch it up, right? I know when I was in undergrad, math was just like, oh my goodness, it was an enemy of many sorts. And so when I would get frustrated with that, I would switch to something that I was better at, and like English, right? I would be able to throw myself into that work and feel that confidence boost up so that way I could go back into that math homework and then feel like I had some more confidence about it. So switch it up. It's okay to be creative about what it is that you're trying to approach with academics. So some resources that we have on campus, one of which is the SMART Lab, the Stress Management and Resiliency Training lab is a really great option. I believe they are still offering services remotely or virtually, and you can still schedule some appointments with them to get some coaching on how to be creative about your strategies with managing stress. But I would encourage you to check them out and look at some of the resources they have on their website for you in this time. So I know we had some questions earlier, so now will be a great time to be able to open up the floor for that.
And just FYI, I'm going to type my email on the chat, so if anybody needs to reach me. I guess we could respond to, I know you kind of responded already to the previous question, which was, are there cultural cues staff look for in Latinx students in order to help them identify mental health concerns? I can only speak on my behalf. I know that the Latinx population is known to, especially like the older population, tends to, come in with physical symptoms. Identifying something as anxiety or depression might be scary because that, especially if they have the mentality of that means I'm crazy. Nobody wants to identify themselves as crazy. And I think it's easier for people to say like, oh, I have a stomach ache, or I'm a little stressed, so really exploring those physical symptoms. I don't necessarily focus on putting a label early on because I know that people have a reaction to that. Another thing would be, I ask the clients, tell me how your family works. What are some of the things that, you want me to know about you that makes you who you are? And I know that family is a big thing in the Latinx community because we are a collectivistic community or culture. So I definitely want to be sure that if I'm giving you coping skills, I'm not just seeing it from a perspective like, oh, well, yeah, you could just say no to your parents and, you're an adult, you do what you want. It's like, no, I know that there's still some things that you have to respect. You still have to, abide by the rules, even if you're not living at home. It's just, there's so many things, And while I know that that is true, I also try not to generalize that to everyone that identifies as Latinx, just because I know that, sitting with someone else that has my same identity, I could tell you that they have drastic different experience than I do, but there are certain things that I keep in the back of my head to ask, and I adjust those to that individual and make sure that my treatment is, being respectful. It brings in their culture. And if I'm having concerns or whatever it is, I do ask them to tell me a little bit more about them. So that's what I do. I'm not sure if you want to add anything, Peter.
Yeah, no, I love that response. I mean, I think it really is about sitting in front of the person that's in front of you and definitely allowing what you know to be a general truth about an experience to kind of guide you into the question or guide you into the relationship can be a starting point, but it is not the absolute truth. I love that that's how you kind of spoke about that, because I think that's true for all of our different experiences and cultures. And so, allowing the person to be able to define it for themselves can be really empowering.
Mm-hmm.
I do have a quick follow-up question. So Peter, can you hear me?
Yes.
Yeah, awesome. So Peter actually mentioned earlier in the presentation about the expression of aggression and being culturally minded when doing that. And he talked about his experience as a Black man. As a Latinx man, there's definitely some similarities. I know Dr. Ramirez in the Latinx culture, there's this idea of machismo, or to be machismo, to be masculine and powerful and strong. So to not cry and to not express your feelings. And so I guess my question would be for those Latinx male students who are watching this webinar, or for future Latinx male students I may have in LSS, how do you help a student like that who may not necessarily gravitate towards speaking in a therapy setting or seek out resources like CCS or Peter?
I think, at least for me, I start focusing more on like the thoughts versus the feelings, because feelings is a no-no, you know? And while that would be the ideal goal for me to have, for someone that is experiencing that or that themselves are doing that, let's focus on the thoughts. Let's focus on how that might be affecting your relationships, because if you're coming in, that means that you kind of have some insight into how it affects your relationships, or at least somebody has told you, even though you might not necessarily admit it, or you're not ready to admit it, which is fine. So that, I think that's what I do. It's like an easy approach. Like, let me get in there, let me build a relationship with individuals, get to know them, because they're doing it not to be mean, but they're doing it because they're raised to believe this, and it's something so ingrained in them. And I don't necessarily want to make them feel like I want to change them completely. You know, it's like, let's take some of the things that you're okay with that, you know, will help you build those relationships, and maybe tweak a little bit other things that might not necessarily serve you. So that's how I start, just kind of focus more on the thoughts versus the feelings.
Awesome, thank you. Also, if there's any other questions on the chat, please feel free, for those attendees who are watching right now, to use that chat function. I do have a quick follow-up question as well. For the academic anxiety study skills section, with the change of COVID-19 and this transition to this online virtual format, what tips do you have for students to make that transition, that remote online transition, as they deal with anxiety and this new COVID-19 world?
Yeah, so I'll say for myself that I have been very heavy on encouraging anybody that I'm interacting with, but specifically clients who are students, to be compassionate and gracious with themselves at this time. I'm a big critic of capitalism. Together, and the reason being is that it really kind of dehumanizes people, right? It doesn't allow us to acknowledge that we are full beings that are not just built for production. And so much of how we understand education is tailored to that, of you show up and you pay attention and you engage, and then you produce the homework, and then you write the paper, and then you do the thing. And that's really difficult right now. That's really, really difficult. And it's not the best measure of how we're doing well at this point, because there's so many barriers for people to continue doing that. So be gracious with yourself, be compassionate, and gratitude can play a huge role into that, right? Of, if I am orienting myself to what I do have access to, and I am functioning with that awareness, then I can be at peace with what is true right now versus what isn't. And that can be hopefully a bit more helpful than thinking about all the ways in which we're failing as students because we're not doing what we were doing when we were in person. I think it's just a bit unfair to the full beings that we are. And so that might be a little bit feely, but yeah.
I like that. I think that definitely applies also to staff and faculty, realizing that we are holistic beings, and our overall well-being is important. I like that.
So just FYI, I had initially written my personal email, so no emails to that. Just send it to my OSU. It's just so automatically. I just like typed it. I was like, oh no.
I'll go ahead and update that post webinar. We'll have updated emails so everyone can use those as well. I do have another quick question. If there are no other questions, just another couple of questions before we close out the webinar today. The other question I had would be about having a good friend and social support network. I recently stumbled across this idea of dismissive and empathic listening, and how one is more prioritized or should be prioritized over the other when being a good friend. Is this true? And if so, what does that look like in a good social support network setting?
I at least for me, I feel like there's not one better than the other. I think that it's really situational. You know, sometimes people need a friend just to listen. And I think it's important sometimes to express those needs, you know, going into a conversation like, hey, I just need a vent. I don't necessarily need feedback, because sometimes we already know that we messed up, or we already know that, you know, whatever it is, you know, it's like, we don't need another person, you know, making us feel any bad, any worse than we already feel. So it's like sometimes being intentional, what kind of conversation you would hope, or if you want feedback. And the same thing for, you know, for you as a listener, I think it's important for you to ask the other person, like, do you want feedback? Because just because you have a feedback, that doesn't mean that I want it. You know, it's not solicitative. So I feel like there's not one better than the other. At least for me, I feel it's very situational.
Yeah, no, I concur with everything that was just stated. That self-advocacy piece. I mean, I don't know that we think about those, what you just described as self-advocacy. I need to let this person know that this is what I need from them. Or maybe I'm being asked of something and I need to tell them that I don't have that to give right now, right? Advice right now, or I actually don't have the capacity to be able to hear somebody else's stressors because I've got my own that are really taking up too much space for me right now. Those are also really important things and can help clarify what is going to be most effective for both people to get their needs met.
Thank you. So as we are nearing the end of our webinar, I just want to say thank you to the both of you. With all that's going on in the world right now, this was definitely a great and informative presentation. For me, I'm sure it is for the students and fellows, staff and faculty who are watching this as well. From major stressors, anxiety in the classroom, different types of anxiety, how to recognize anxiety, depression and self-care. There's a lot of informative tidbits throughout this webinar, and thank you both for that. I do want to just say, especially, I did like the, if you tell your mind tells your body to relax, and then your body will tell your mind to relax. I like that idea, that notion, this cyclical idea of your mind and body working with one another. That said, I do have our final question of the webinar. You both mentioned that one of the major stressors for college students is change, whether that's change and anxiety and change and depression. And as we all know, there's a lot of change going on right now with COVID-19, starting a fall classes in just a couple of months, with Black Lives Matter movement. It is an election year. There's a lot of change happening. And for those incoming freshmen, Latinx students, starting college is a big change. So all that in mind, what are the 3 key main points that you would like for those listening in right now and those listening in at a future time to take away from this presentation today?
You can take it here if you want.
Well, so I know we chatted a bit about this before we began, but I think after the conversation that we've had, it really does kind of just reinforce kind of what we've already named about really be curious about the ways that you're identifying anxiety and how you're responding to it, as with depression, and be really intentional about what self-care looks like, right? If you know that it's something that is adding to avoidance, right? If self-care is, I'm gonna watch this Netflix show, that's great. But if that is what you're doing to avoid dealing with something else, that's not great. To be honest about that is really, really important. And maybe building part of your support system to be part of what holds you accountable to that can be helpful too. And so really just be intentional will be my takeaway with how you're identifying anxiety and depression, and then really being honest about how you're responding to both of them.
Yeah, I will probably add identifying, you know, what is causing anxiety or depression, and breaking that up into, you know, either smaller things to be able to find solutions for. Because sometimes when we see it as a bigger thing, it would increase that anxiety or depression, because it seems like it's not going to be possible to get there, right? You know, and sometimes knowing that you might not have control or the ability to fix anything or fix the whole thing, but is there something within, if you break it down into pieces, a small piece, is there something that you could do, you know, that will be able to make things feel a little bit less stressful, a little bit less, you know, it would trigger a little bit less depression. So I will probably add that, just breaking things up into smaller pieces.
Thank you. In closing, I want to thank the panelists today, Dr. Ramirez and Peter Oduwali, our attendees and future viewers for joining us today for our second virtual webinar. Should you have any future questions, comments, or concerns, please do not hesitate to contact me or either of our panelists. Thank you both. Thank you to the attendees, and have a great day.
Thanks. You too.